And thank you for choosing Juventix Regenerative Medical for your clinic's regenerative medicine needs.
Today we will review setting up the procedure tray for platelet-rich plasma and biotin hair restoration. Begin by preparing your Mayo stand utilizing a sterile drape. Once the sterile drape has been laid, begin to assemble the products and supplies necessary to perform the procedure. Starting with the Juventix Biotin PRP kit. Open the packaging to reveal the sterile tray. The sterile tray will contain all of the components necessary to perform the draw and processing of the platelet's whole blood to produce a preparation of platelet-rich plasma and biotin, vitamin B7, which has been shown to increase keratin structure to provide thickness, shine, and durability to the hair follicle. Place the PRP kit sterile side up onto the procedure tray. It will be necessary to clean the area of injection. For hair restoration, we recommend the utilization of HibaCleanse or other large format antiseptics that can be applied utilizing 4x4 gauze. In the event you do not have those available, alcohol preparation pads may be used. 4x4 gauze are necessary to hold pressure to the injection sites in the event of any excessive bleeding. It's always a good idea to have an ammonia ampule handy in the event that a patient becomes faint or temporarily loses consciousness associated with any pain or discomfort from the procedure. As 10 mL of platelet-rich plasma and biotin will be yielded, it is a good idea to have a 10 mL syringe handy for extraction. For the purpose of hair restoration, the PRP and biotin concentrate will be drawn into individual 1 mL syringes. It will take approximately 10 1 mL syringes to hold the contents prepared by the kit. A tourniquet will be necessary for the intravenous blood draw. Anesthetic should be applied to the patient's scalp to increase comfort and patient compliance. Benzocaine lidocaine tetracaine cream in the concentration of 20-10-10 is preferred. Lidocaine 5% USP can be used as an alternative. When your PRP biotin concentrate is drawn into the 10 mL syringes, each syringe will need to be capped or attached to a needle. For the purpose of hair restoration, we recommend 30 gauge half-inch needles. The 10 30 gauge half-inch needles will be attached to the 1 mL syringes after processing. Sodium bicarbonate may be used to reduce the acidity of the solution and to increase patient comfort. Discard the sterile covering. Locate the biotin PRP tubes. Each tube consists of 2 mL of vitamin B7 biotin to increase keratin structure, durability, luster, and shine of the hair follicle, along with the gel separator and anticoagulant preparation. Upon processing, roughly 4 mL of platelet-rich plasma will be produced, buffered with 2 mL of biotin. Each draw requires about 8 mL of whole blood from the patient. Locate the tube holder. Attach the tube holder to the other end of the butterfly needle. Set aside to use to fill your tubes. Place both of your tubes onto the Mayo stand to fill with the patient's whole blood. Retain the 18 gauge needle for harvesting, the stopcock for transfer to the 10 mL syringe, followed by transfer to the 1 mL syringes. The 2 mesoneedles for venting of the tube. For hair restoration of an entire scalp, the 5 mL and 2 mL syringes are not necessary. However, for smaller areas, if you're going to utilize only one tube, the 5 ml syringe is sufficient to draw your preparation. The 2 ml syringe can be used to buffer into individual injections. We will now draw the patient's blood into the tubes. Be prepared with the tourniquet and an alcohol pad to prepare the site of the intravenous draw. Attach the tourniquet to the midsection of the limb above where you intend to do your intravenous blood draw from.
There's no reason that you can't go over somebody's clothes as long as you make the tourniquet tight enough.
Clean the area of the site where you intend to draw the patient's blood. Feel to identify an appropriate vein for draw. If you're unable to locate an appropriate vein, ask the patient to clench their hand to help make the veins appear more superficial. Once you see blood flash into the butterfly needle, you're ready to attach the PRP biotin tube. Fill the tube roughly to the top of the label. This will represent 8 mL of the patient's whole blood being drawn into the tube. This will be centrifuged for 8 minutes at 3,500 RPM to prepare the solution with the biotin for hair restoration. Repeat with a second tube to treat the entire scalp. After the blood draw is complete, invert the 2 tubes of PRP 2 to 3 times to buffer with the anticoagulant. You are now ready to centrifuge the Juventix biotin PRP tubes. Blood draw tubes are completed with centrifugation. You will see a layer of straw-colored clear fluid above the gel separator. This is the platelet-rich plasma that has buffered with the 2 mL of biotin, vitamin B7, for keratin structure enhancement. The red blood cells, granulocytes, and other materials that are unhelpful to the procedure are shown below the gel separator layer. This will be discarded into a sterile collection bin or biohazard storage device. To draw the blood from the vial, take one of the 30-gauge mesoneedles, remove the cap, and puncture the top of the PRP biotin preparation tube. This creates a vent to allow air to escape and will make drawing the PRP biotin mixture from the tube easier. Next, take your 10 ml syringe. Open the syringe and attach the 18-gauge spinal needle to prepare the biotin PRP mixture from the tube. While holding the blood collection tube in one hand and the collection syringe in the other, penetrate the top of the PRP biotin tube. Advance the needle to just above the gel separator layer. This is the ideal location from which to draw the biotin PRP mixture. Draw back on the plunger of the syringe until the entirety of the biotin PRP mixture is within the syringe. Rotate the tube to keep the lowest point above the gel separator equal with the tip of the needle. No remaining fluid should be within the tube upon extraction. Repeat with the second tube. Discard the mesoneedle and the empty PRP biotin collection vial into an approved sharps or biohazard storage receptacle. Repeat with the second side. Inverting the tube slightly will reaggregate any platelets that may have accumulated on top of the gel separator layer. Vent the PRP biotin tube with the 32 gauge mesoneedle. Insert the collection needle into the PRP biotin tube. Advance this to the lowest point above the gel separator layer. Extract the PRP biotin mixture into the syringe. Once complete, you are ready to transfer the PRP biotin mixture into the 1 ml syringes. Remove the 18 gauge blood collection needle. Discard in an approved receptacle, such as a sharps container or biohazard storage unit. Attach the stopcock to the 10 ml syringe. Lock into place by turning clockwise. Open your first 1 ml syringe. Attach to the other end of the stopcock. Holding the 10 ml syringe on top and the 1 ml syringe on bottom, extract 1 ml of biotin PRP mixture. If any air bubbles exist in the 1 ml syringe, tap the syringe to move to the top, push back into the 10 ml syringe, redraw to the 1 ml fill line without any inclusions of air. Remove the 1 ml syringe. Attach the 30 gauge half-inch needle to the 1 ml syringe. The 1 ml syringe is now prepared to inject into the scalp for PRP biotin hair restoration. Repeat with the remaining 9 syringes. Utilizing a syringe cap, cap and store any excess biotin PRP that may exist. This can be used for microneedling or derma rolling into the patient's scalp after the injection procedure is complete. Discard the stopcock and any other sterile supplies that have left any trash on your tray. We are now prepared to inject the PRP biotin mixture into the patient's scalp for hair restoration therapy. At this time, you should have remaining on your sterile tray ammonia ampule in the event that the patient becomes faint or unconscious, sterile gauze to utilize to apply pressure to any excess bleeding, isopropyl alcohol pads or Hibiclens to apply to the scalp prior to the procedure for sterility purposes, anesthetic such as BLT, 20-10-10 compound mixture, or in the event that is unavailable, lidocaine 5% USP ointment as you see on this tray today.
Numbing agent on, and I'm just going to kind of show you one little spot here. You're going to start like when you draw their blood, and that way it's not as big of a deal, and that way it can numb in. And if you're talking about doing a surface like this, then you can numb that. If you're talking about doing the entire head, I usually do 1/2 of the head and then do the other half of the head, because it's not going to last on one side. So as I call this, I just gobbledygook. And usually within about 15-20 minutes it will numb. And then you always want to clean the area before you start the injections. So, and then you can start. So the easiest way to do this when you're starting is you can either start in the middle and work your way out, or you can start on the outside, work your way in. I tend to start on the inside and work my way out. You're going to have the bevel up, just like you would for any other procedure. 1, 2, 3. And you're going to slide it just right underneath. And you're going to pull it out as you go, just like so. You okay?
Yeah, that's just a little pinch. It's not bad at all.
Some patients are better at this and more tolerable. Some are wimps. So one thing that you want to tell patients when you're doing the hair restoration is that the hair is going to be a little bit thinner than it used to be. And it's going to also be like little sprouts. It takes time for the newly restored hair to really grow out from the root. Now you can use the 30 gauge 1/2 inch, you can use the 30 gauge 3/4 inch, you can use the 30 gauge 1 inch, but you don't want to go bigger than 30 gauge and you don't want to go smaller than 30 gauge. And so you can see that it really doesn't cause that much bleeding. There's just a minimal amount. So.
How many injections did you get over the first syringe?
10?
So about 0.1 cc per injection site.
Correct.
I didn't even feel all 10 sticks.
Mm-hmm. Maybe I know what I'm doing.
Just a little.
Now, one thing that patients will ask me is, can you do this with just straight PRP? The answer is yes, but you don't get as good of results. So you really do want to have it mixed with the biotin. Because as you know, that's what really helps promote hair growth.
I did notice a big difference between my first injection with a standard PRP preparation and the second with the biotin. I mean, it was visibly a noticeable difference after about 3 weeks.
Yeah. It's very, it's noticeable.
And the biotin really helps to support the keratin structure, so you get a thicker and higher luster hair follicle, so it makes it look more full.
Right.
Even though you're not stimulating additional follicles to grow, you're getting more coverage out of each individual one.
Where we
So
stop
do you do a radial pattern?
Mm-hmm. Yeah, I'll start from the center and then I come all the way around because I find that that's the best. It's easier to keep track of where you've been and not been if you come around. that way. The other part of this is that when I'm looking at it, I also look and see, is there, because, you know, everybody loses hair in a different way. So not only will I take the, you know, circle pattern, but then if there's specific areas of weakness within, you know, they're outside of that circle, part of this is figuring that out as well.
And about how far apart is each injection site?
About 2 to 3 millimeters. So very tiny.
Oh, that's cool. I could hear the fluid from that one.
That one too? Or just that?
No, I felt it, but I didn't hear it. The one before it, I actually felt the slushy of the injection inside my ear. That was pretty cool.
See. You can also do this. The great thing about this is I had a patient that was transitioning or had transitioned and had hair plugs put in and had scars. And if you do this along the scar, you can get growth coming out of the scar tissue as well.
I also saw a female to male transition where this was used to enhance the growth of their beard. And it was very effective in that regard as well. And also in a military veteran who could only grow about 2/3 of their beard due to some previous burns from an improvised explosive device, we were able to get regeneration of the beard on that side of the face and also reduction of the keloid scars.
Cool.
Well, 2 for 1.
That is. Now the one thing that it will not correct is alopecia, like actual alopecia disease, because that's a lack of the follicle completely. But
So what about alopecia areata?
that can help that. But if you have somebody that's, well, I watch American Ninja Warrior. So if you have somebody like Kevin Bull, where he has no hair pretty much to his entire body, you know, you're not going to be able
So
to.
what's the indication for a scalp that might benefit from it? Are you looking for peach fuzz? What lets you know as a provider that that scalp's a good candidate for this?
If the progression of hair loss has been a time issue versus a disease process, if they've had alopecia, you know, they were started in their childhood or teenage years and they're completely, you know, they have no hair, it's just different than having hair but missing a section.
Gotcha, thank you. So how far through are we now?
We've done 3 syringes, so we have,
And how much of the scalp have we covered so far?
well, we've almost gotten, so if we take our circle, we've almost gotten completely through our entire circle.
Great.
So we just have to do the last half, and then we go searching for the bad spots, i.e. the other spots that are not as noticeable as this. So one of the things that I tell my patients as well is I don't want you to go home and wash your hair, and you can wash it tomorrow morning. You want to really let the effects stay there for a good 8 hours. Do its thing. And from a provider standpoint, make sure that you've got a good hour to be able to do all of this, because it does take time. It's not something you can just do quickly and run out the door. And then also tell the patient that the little bumps that they can somewhat feel will resolve within a couple of hours.
And those are little boluses from where the PRP biotin mixture is subcutaneously?
Correct.
And I've also often had people ask how deep they should be with the needle. Some people wonder, oh, do you touch periosteum, or what's the recommended depth for each of these injections?
So the recommended depth is to come under, it's almost like doing a complete subdermal injection. If you go like, you don't want to be at a 90-degree angle to the skull, because we don't want to go down to any of that.
So about what angle would you recommend? Maybe a 45-degree angle?
It's about a 20-degree angle as you go in. But you do want the patient to have washed their hair before they came in. You don't want nasty hair.
And no hair products, right?
No
gel,
hair products, no
hairspray.
gel, no hairspray. You also want to tell them that they shouldn't color their hair within a 30-day window.
And then what about sun exposure in hats?
So there was mixed reviews on that. I tell my patient to just stay out of the sun for a couple of days. I tell them that for anything PRP in the face, fillers, just be smart. Don't go out on the beach for 8 hours and cook yourself.
And then how about wearing hats? Is that a good idea, a bad idea?
So I have mixed feelings about hats. I have some patients that aren't going to go out without a hat on. Sometimes that can actually suppress the growth of the hair follicles themselves. So, if they want to wear a hat, just as long as they understand that that's their choice. But it's compressing, and you don't want to, compress something that's trying to grow new. All right. So we've kind of done that patch. So now we're going to take another, and we're going to kind of check the areas.
Oddly, that feels good. Is that alcohol?
Mm-hmm.
Usually that stings or burns, but oddly it's cooling and feels good.
Mm-hmm. Yeah, it's the way, if you use it the right way, it does feel pretty good.
And then any other post-treatment instructions for the patients?
So no anti-inflammatories for 3 days. If it's sore and they need to put something on it, heat is better than ice for the 3 days. And then past that, not really.
And should they avoid swimming or any other activities like that?
Again, that's another mixed opinion for people. I usually tell them that for the hair and face and other types of shots with PRP to just hold off for a day or two. Because you don't want the chlorine to be going into, an area that's open that you're trying to get growth from.
Mm-hmm. Makes sense.
And if you do have an area that's still kind of oozing or bleeding, if you take a little bit of the PRP and just rub it on the outside like this, it'll completely make the bleeding go away. And then you can spike their hair and this side. So as you can see, this is the main area, but you can see here the thinning that comes all the way to here. So we'll do this section next. Actually going to come from up here. And for those people like me who are short, if you come in, because now I can see all the way across, and I'm just going to come, and this is going to be doing all those little spots as I was saying that he also has. One of the things that I recommend to my patients as well is Vitamin Med has shampoos and conditioners that have stem cell in them.
I've actually used those before, and I can tell you from first-hand experience, they really do work.
Yep.
Plus, it's important to use a shampoo after this procedure that's chemical-free. So I'll oftentimes recommend that people use Johnson's Baby Shampoo if they aren't certain if their shampoo has chemicals or not. But you definitely don't want to use any anti-dandruff shampoos like Salsam Blue or Head and Shoulders. And for how long after the procedure would you recommend they avoid medicated or chemical shampoos?
At least a week or two.
And then how do you feel about minoxidil, people that are on topical minoxidil?
I think it's a waste of your money. Personally, I've never had anybody that's done well on that. This, yes.
And have you had any patients that failed with minoxidil and then responded well to
Yes.
PRP hair restoration?
Pretty much all of them.
That's excellent. And then how many times would you recommend that somebody has this procedure repeated, and based upon the thinning of their hair, is there a different recommended repetition for people?
So it used to be the recommendation was once a month for 3 months, but now the recommendation is that you do it for at least 4 months. I usually tell my patients 6 months. So you do this once a month for 6 months, and that'll give you the best growth and let you be able to see the hair popping back up.
And then how do you feel about combining PRP hair restoration with other injectables like exosomes or mesenchymal stem cells?
Oh, I think that's excellent as well. I think that if you haven't responded as well with PRP and biotin, then I think adding some exosomes, if you haven't responded, I would say within the first 2 treatments, then yes, adding exosomes to the mix would be great. For those who don't know what exosomes do, they're a little bit different than the traditional stem cell, and there's billions of them, and they really do flood the area with a lot of cytokines, growth factors, all those kinds of things, and with collagen and biotin. So still doing okay, sir?
Doing fine. Doing fine. Not bad at all. A couple spots here and there that were a little tender, but I can't feel most of them. Or just a tiny little pinch.
Mm-hmm.
Not even as bad as an ant bite.
And so you can see that I did this area. Now I'm working my way over, and that's where, you know, if you are a shrimp and you can't see great, getting on this step stool is really beneficial, because it gives you an idea then of other areas that you need to address. One of the things I get asked is, would this help widow's peaks? The answer is yes.
Really? I have one.
Mm-hmm.
I didn't even know that.
Yeah.
So you can fill in the hair more next to it to make it less dramatic?
Yes.
Well, that's really cool. Let's do that.
Okay, let's do.
I don't mind my widow's peak, but my wife's not a fan. It reminds me of Eddie Munster.
Mm-hmm.
One of the greatest theme songs of all time.
So this is what he was talking about with this widow's peak. Right there. See, you can see this one's covered up by the hair, so it's not as noticeable, but this one has really thinned out, so that's what we're addressing. Now, until you get used to it, and know kind of how you're going to do it, if you draw more syringes, that's okay. And
what are you doing on your leftover syringes that you might not have used?
so I'll send them home with the patient, and tell the patient every 2 hours to kind of wet the area down, and use about half of the syringe to wet the area, and do that until the syringes are gone.
And what about microneedling or derma rolling in office?
I love the derma roller as well. But I find that for at least the first couple of treatments, that doing the injections is a lot more effective.
Would you ever do both at the same time?
Sure. I have. It's sort of like using, doing a filler in the face. So you can do regular PRP and then do the filler.
And you get a better result when you combine the two?
Yes. After you've prepped, you need a month or two to prep the area, I think.
So the derma rolling you find to be more effective in the later injection series?
Correct.
Great information. And is the idea behind a derma roller that it stimulates the erector pili muscles and helps the hair stand up and look more full?
Yes. But, and they can derma roll at home as well. It's not going to hurt anything to derma roll. And again, Vitamin Med has got lotions and things like that that have stem cell in them that will help that. You can even derma roll your face. Be a little weird, but you can do it.
I've actually seen some people derma roll their face, especially on their nose and forehead where they have a little melasma.
Mm-hmm.
And it has minimized the discoloration and the size of spots.
Especially for my, the great thing about this and doing any type of PRP is because it's the patient's own product, it's not like they're going to have a reaction to it. So I've actually done that for a patient that had been pregnant that had melasma really bad post-pregnancy, and we were able to clear up most of it off the face.
That's how the PRP facial became so famous. Kim Kardashian had that done when she was pregnant, and social media shared a picture of it, and that's really how it started to get mainstream awareness of the procedure.
I know, but
That is interesting for people that want to keep their look up during pregnancy.
exactly.
Then again, you already get a natural glow from that.
Yeah. Weight gain.
Heartburn, sciatica, urinary incontinence.
Constipation.
Yeah, we're the whole game.
But it's a trade-off. You get a baby at the end, so there you go.
You ladies are tougher than us men.
Oh yeah.
There's no way we'd make it through that.
So as you can see, I'm just kind of going in where I can notice spots and using the last couple of syringes for these spots.
So how many syringes have we gone through so far?
I'm on number 8 of 10.
Quite a few then.
Mm-hmm. And as you can see, it's just a systematic, kind of making sure you've hit everything. Let's see if we can get a swoosh sound again.
Nice try.
I know.
I did hear that one. I don't know why. I don't know if it's because that's parallel to the ear or what.
It is.
Oh, that's pretty cool.
This is where If you're testing hearing, you actually put the tuning fork right here.
Oh, that explains that.
Yeah. Mm.
That's neat.
Medicine is so cool. This one section. So now I'm just basically making sure that I've got all the sections that I want to get. And one question I get asked is there ever too much? And the answer is no. The great thing about PRP is it has the ability to go within the same area where it's needed. So if you were to go and do injections right on top of each other, it's not going to hurt anything. You can see that when I'm doing the back, I'm pulling up the hair like this so that I get a really good pattern, so that I can really see the thinning.
I didn't even know you had thinning back there.
Mm-hmm. Yeah, you've got some patches of thinning.
Oh no. I'm getting old.
Oh, you poor thing.
Oh, we should have took before and after pictures.
Yep, we should have.
Guess I'll do that tomorrow.
So see, we already got all of this thinning, and we've gotten down here. And you can see we've gotten all in here. You see little small pokes, small pokey pokes. And this feels really good after you've done the procedure.
Yeah, it does. Nice and cool.
Mm-hmm. So I like to make my patients feel, there's a certain amount of pain you're going to have from any type of procedure, but you can make it be comfortable after the fact. So remember, don't wash your hair for 8 hours.
Okay, boss. Didn't even feel that one. I felt the cool from the spritz more than I did that last injection.
Mm-hmm. So now you can make them all pretty.
Get a little hair restoration and styling.
Exactly. Well, you know, you're going to have women that are going to... Well, I think there are some guys that are as vain as women, so...
If not more.
If not more. Exactly. Alrighty.
I've got a client that wears a boy's medium to make sure people can see his physique.
Oh, yeah. Alright, there we go. And that's all.
Thank you so much. That wasn't bad at all.
Thank you.